New Haven County, a group fighting tonight to keep Waterbury Hospital as a community hospital.
The facility has new ownership, and the hospital is now for profit. There was a meeting this evening to express community concerns. News 8's Jackie Slater was there. She joins us live from News 8 Control. Jackie.
And Prospect Medical Holdings bought Waterbury Hospital last October for $43.3 million. 1 year in, and some local religious leaders are raising concerns in 5 key areas, saying they don't feel the hospital administration is listening. More than 125 years as a not-for-profit. Pastor Rodney Wade saying Waterbury Hospital was built with nickels and dimes from congregations all over the area. Tonight, residents and religious leaders in the Naugatuck Valley Project voicing concerns that the once community-focused institution is changing.
Our position is not transactional. Our position is relational. It's very important to us as pastors. It benefits our church. It benefits the hospital when people are well, when people are healed.
Purchased by Prospect Medical Holdings, a California-based for-profit company, members of the NVP cite 5 key areas they believe are in danger. The first being a lack of diversity on the hospital's advisory board.
And this board is comprised of about 12 people, one of which is an African American, one is female, and they're both the same person.
With such a diverse population in Waterbury, the fear is hospital leaders will not be able to identify with the people they serve. Other concerns include high readmission rates, cuts in staffing, a lack of sufficient pastoral care for patients, and whether or not patients will be turned away if they can't pay.
We're concerned for our congregation, for the people in our congregation, and we have heard those concerns in terms of the change that is happening.
The clergy say attempts to discuss the issues with the CEO and other executives fall flat. Tonight, a representative from the hospital in attendance, hoping to ease the fears.
We hit the ground running with Prospect Medical Holdings, and we have expanded some of our community programs and outreach, and we've expanded some services into the community.
On tap, a major addition to the emergency room, which serves more than 50,000 people each year.
And they've invested millions of dollars in our campus. We'll definitely be here and taking care of our community and listening to their concerns.
The clergy invited the new CEO of the hospital to tonight's meeting, but he did not attend due to a prior engagement. Now, as part of the sale, the state requires the hospital to hold public forums twice a year to discuss concerns. The next one is scheduled for November. Live in the newsroom, Jackie Slater, News 8.